I want to say again, this is an honor to start us off this year with a presentation on a very important topic. It's on sexuality in those on the spectrum. I think there's a lot of information in the slides. I doubt that we're going to get through all of them. You guys going to get a copy of it through PDF. I think Robin or Judy will be able to email it to you, so you don't have to take copious notes on our topic. You can just try to sort of read along with me, or try to listen. And if you have any questions, feel free to ask, as Robin mentioned. So let me start sharing. A second. Here we go. Let me get to the slides.
Thank you.
Okay, there we go. Okay. Because I actually don't see anyone's picture, so if you raise a hand, I would not know. So I'm going to use Robin to kind of guide me if anyone is trying to say something. Okay, so like I said, welcome to our presentation on sexuality on the spectrum. I think it's important to start by defining what sexuality is and what it really means. There's 5 features that are related to sexuality. It's sensuality, intimacy, sexual identity, reproduction, and sexualization. These are all aspects of what we commonly just use one word to sort of comprise all of this into one concept of sexuality. Now, this diagram is actually really helpful. I think it defines fairly well all of these different aspects of sexuality. And it defines these aspects as well. So, for example, with sensuality, it involves one's level of awareness, acceptance, enjoyment of one's own and other bodies, right? Sort of being sort of comfortable with that physical experience. Intimacy, it actually is misused a lot of times, but it really is related to the experience of closeness with another person. So caring for them, loving, liking them, being vulnerable with somebody, being ability to trust and experience reciprocity. That is what's really called intimacy. Um, Sexual identity, we'll talk a lot about that because I think it's really relevant. So basically how we perceive ourselves as sexual beings. So biological sex, gender identity, gender expression, sexual orientation. Another part of the sexuality, of course, has to do with the sexual health and reproduction, and it involves all of the sort of biological processes that have to do with our sex lives, including reproduction as well. Um, and the last important category is sexualization, as that is something that involves the use of sexuality, right, to influence, control, and sort of have effect over other people. Now, all of these are, of course, affected by the values that you grow up with, by the values of your community, by the values of your family. So again, they don't exist on their own. They're all kind of overlap and interconnected with each other. So, but these are the 5 aspects of our sexuality that work together to create this picture of who we are in terms of us being a sexual being. So, World Health Organization defines sexuality as something encompassing identity, intimacy, desire, thoughts, behaviors, and relationships. I think it's important definition, and so the reason why I'm using this because this is these are universal concepts, right? They're applicable to any ethnicity, any country, any culture, but again, they may be affected by the cultural values, as we said earlier. Now, it's important to remember that sexuality is not limited to sexual activity, right? Even though the word sex is as part of the word sexuality, it's not just about that. Understanding this broad definition especially is important for when we talk about individuals on the spectrum. And the reason why, because there's 3 different aspects of this. The cognitive, there's the emotional experience, and there's behavioral expression. And they may differ from one another in this particular population, and you'll see how that may be so and why, right? Now, so the reason why we try to reframe away from the misunderstanding of what sexuality is being not only sexual activity is so it helps the parents, it helps the individuals, it helps the clinicians and whoever else is involved in your life to be able to focus on appropriate sort of concepts rather than just observation alone. Okay. If you just base all of your decisions on observation, you're probably going to miss a lot. So again, that's why it's important to engage in a deeper conversation about those different aspects of sexuality. Now, why does it matter for those on the spectrum? By the way, that's a little image of the TV show Love on the Spectrum. I'm sure you guys either heard of it or watched it. Um, it's definitely a representation of the fact that individuals on the spectrum, just like anyone else, have the same sort of desire for love, for relationships. It may be expressed differently, but the desire is there. Um, so sexuality is central to the identity and our well-being, right? And as we said earlier, it includes emotional, behavioral, and cognitive and psychological components. Now, it builds our self-esteem and sense of belonging based on these identification, based on where we group or put ourselves. It actually allows us to understand where do we belong. So it's another aspect of our identity, personal identity, that navigates us towards the right group. Unfortunately, historically, it's been minimized or avoided for those on the spectrum, either due to stigma associated with talking about sex with someone with autism, or just pure discomfort of the professionals. And it's only professionals who are at fault with this. But because of that, there's definitely gaps in research and clinical training, unfortunately. Will talk about some of the research, and you'll see how during recent years we've seen a lot more information that's coming out, which is important for us. It's also important to remember that autism has always been seen and still categorized as a childhood disorder. Um, it is very interesting because why it's still so, because at this point we see that this is not a childhood condition. This is a sort of lifelong condition that develops and evolves as the person is getting older. And so we have more and more adult population who engages in adult relationships and intimacy and develops their sexuality, and we definitely need to have a lot more education available for individuals on the spectrum and for the parents and professionals as well. So that's why it's important. No, that's why we're talking about it. As I said earlier, the historical assumptions were, unfortunately, that individuals on this spectrum were asexual, right, or childlike, or uninterested in relationships. Now, we now know, and you'll see from research that'll present you guys, that that's not the case. However, unfortunately, that led to what's called infantilization and overprotection of people on the spectrum away from that concept, and therefore created a significant lack of psychoeducation, right? So because we were overprotecting, we thought we are doing something good. In reality, we were actually causing some harm with that. So now we know this to be different. Okay. Um, so let's talk about the sexual just the concept of sexuality, and there's multiple concepts I'm going to present today so that we have better understanding of the differences or different aspects of our sexual identity and orientation, so that we can use them appropriately and understand where do we sort of fall in those categories. So what is sexual identity? Sexual identity is how an individual understands and labels their own sexuality. So basically it is my label of myself, and it reflects my personal sense of self and lived experiences within that sexual identity. So for example, if I identify as straight, it means that this is how I see myself, and this is how I experience life as, for example, a straight male. Um, Gender identity is something that's been actually a lot in the news in the past 5 years or so, definitely, and a lot of controversy around that. But what is it? It is an individual's internal sense of their own gender. So it may or may not align with what sex you were born at birth. So if I was born a male, but I do not feel like a male, I will begin to identify, for example, with a more female aspect of my gender identity, And the examples here are the man, the woman, somebody who's transgender, somebody who will say they're non-binary. Basically, they don't want to use any particular category to identify because it doesn't define them as well. Gender queer, meaning again, sort of this fluidity. So, and then there's sexual orientation, basically a pattern of sexual attraction toward others. Basically describes who someone's attracted to, right? So it's interesting because sexual identity and sexual orientation are kind of similar or sound similar. So the real difference is, again, to go through them again, sexual orientation refers to a person's pattern of sexual attraction, right? It's somebody who you're attracted to, describes who someone is attracted to, often discussed as more stable underlying experience. So it's there and it stays. Pretty solid once we sort of get into our 20s and 30s, actually, closer to 30s. For example, heterosexual, gay, bisexual, pansexual, asexual, and then we'll get into definitions of those a little bit later. Now, sexual identity refers to how a person labels and understands their sexuality. So it's just my personal label for myself, right? So the key distinction in one line, sexual orientation equals attraction, sexual identity equals self-label. Okay, so hopefully that helps you see the difference. Okay, so we've definitely heard of some of these before, and you probably know what they are, but I think it's good to just go through them anyways. So somebody who's heterosexual is somebody who has attraction and preference for romantic relationships with other gender, right? So male is interested in female, female is interested in male. Homosexual is an attraction and preference for a romantic relationship with the same gender, so male to male, female to male, female to female. And bisexual is an attraction and interest for a romantic relationship with both genders, so basically not having any particular preference rather than appreciating both. Now, what we've seen also in research and in practice is that, interestingly enough, the sexual feelings that people experience in their teen years and sometimes in young adulthood do not necessarily stay throughout adulthood, right? And so, again, we've seen these evolve. Like I said, that's why we have to wait until someone who, closer to their 30s before we begin to see some kind of solidifying of their self sexual orientation and sexual identity, both. So it's fluid in the teenage and young adult years, especially as we call it, those experimental years. Okay, so some of the other identities other than heterosexual, homosexual, bisexual, there's something called pansexual, and that is a person who is attracted to people from across the gender spectrum. So pansexual people recognize all genders, but do not consider gender when choosing a partner. So basically, even though they recognize that there's different genders, it's not part of their consideration in terms of how they would choose their partner. So they're aware of it, but they're not using that as a valuable consideration point. Asexual person, oops, that's a mistake. A sexual orientation is an umbrella term for people who don't feel sexual attraction, right? Asexual people can have intimate emotional and intellectual relationships, right? So one can be in a very close relationship through caring, loving, reciprocal feelings, being very emotional and have a sort of very rational intellectual connection with somebody, but they might not be interested in the sexual experience itself in actually having intercourse or engaging in other forms of sexual process. So they will frequently identify as asexual, meaning they want a relationship with someone, but it won't be based on a sexual process. Now, transgender, and I'm putting it in this category, which technically is a gender identity rather than sexual orientation. But I still wanted to bring it up because, like I said, it's been something that has been discussed a lot in the news, and so a lot of people in my practice are talking about it, my clients. So it's a term that describes a person whose gender identity does not match their assigned sex. For example, someone who was assigned female at birth, who identifies as a male. Transgender people may alter their bodies using hormones, surgery, both, or neither. And again, some of this information is already known to you, but because we've said earlier that we frequently assume things about our population, I'd rather not sort of assume that everyone knows this and put it in slides. So there's, oh, that's different font. Okay. There's also some other interesting sexual orientations or identities. For example, queer is an umbrella term for sexual orientation that are not exclusively heterosexual, often used to express fluid or non-binary attraction, right? It's fairly similar to pansexual, but the fluidity is what's important, right? So sometimes one can go into one category and then sort of then change into another. So that fluidity is represented by the term queer. Demisexual is a sexual attraction occurs only after forming a strong emotional bond. And by the way, you know, when I work with my adults on the spectrum, I think this is a very important one to understand and know, because that is really what we're trying to go for, regardless of all the other ones, because what we need to see, we can form a connection, right? If we can form that attraction towards someone else without necessarily focusing on the sexual attraction itself. So first develop a relationship, and then it grows into the sexual desire towards one another, rather than just going first for the sexual desire and then see if you can develop a relationship. Um, Gray sexual or gray asexual sexual attraction is rare, infrequent, or context dependent. So basically, this is when someone is very unlikely to develop that sexual interest in someone, but rather they or never develops that sexual interest, and therefore they stay in the stage of just being interested in a relationship, similar to somebody who is asexual, without going to that next stage. Okay. Omnisexual
Dr.
attraction to people.
Dr. Gantman,
Yes.
sorry to interrupt you, but I have a question. What does sexual mean to you in general scope, like in the world? What does sexual mean? Does it mean like you having sex? Does it mean like love and sex? What does the word sexual mean?
Well, again, that's what we can go back to the concept of the sexuality, right? So sexuality is all of these things together. So when someone's sexual, they talk about all of these five categories interplaying with each other. They include the sensuality, sort of the comfort with the body, the sexual response, the feeling that you have, the desire that you experience. It's the interplay, of course, with intimacy, and a lot of times we focus on intimacy as defining a good relationship, right? Um, the concept of your sexual identity, as we're just going through this right now, so that it's helpful for you to identify yourself, and also allows you to find the proper place for yourself in the community that you're in, right? So you can feel connection with other people, so you feel normalized in terms of your experiences, as well as how we're affected by sexualization that we experience from media, or our community, as well as just the basics, right, of the sexual health and reproduction. So these are all working together to develop that one concept of sexuality. It's very difficult to say what sexual means. To each person will have their own definition of that. But that's a great question. But again, in the way that I see this, it's all interplay of these five categories through your value system, right? There's definitely a lot more focus on certain ones in our society, but I think all of them are very relevant, and they all come into play at one point or another, depending on the situation and what it calls for. So, um, going back to this slide, just so we can finish these different sexual orientations. Omnisexual attraction to people of all genders, with awareness of gender as part of the attraction. Remember, pansexual person was attracted to all genders, but was not recognizing the genders as important for their considerations of choosing. Omnisexual is attracted to all genders with awareness of gender as part of their attraction. So it includes that. And so the androsexual and gynosexual orientation is really kind of focusing on the presentation more than anything. So the masculinity, right, versus femininity, regardless of the person's gender identity, regardless of their um, self-identity. Let's say, for example, a very sort of feminine male can still be something that, for example, an gynosexual person is really interested because of the femininity rather than their gender per se. So it's the way that they present and behave and think and feel and express that will be more of important than the actual male female category, right? So we definitely see that from research that there's definitely higher rates of same-sex attraction, bisexuality, and sexual fluidity among individuals with broader autism phenotype. Now, it's important to understand sort of reasons why that may be so, and we can talk about that later. But I wanted to get into some of the research studies that were much more recent. I have a number of slides of the older studies. We're going to skip through those. You guys can look at them separately, but these are very important because they're finally getting to the point where all of these studies are kind of converging on the same sort of data and the same outcomes. So therefore, that means we kind of, when multiple studies show the same outcomes, that means we're kind of getting the right answer at this point. So in 2020, there was a study on asexual identity in high functioning autism. And it was very interesting how these different asexual identity themes around attraction versus behavior versus intimacy were described. And showing that really there's no one pattern of how that could be viewed, because again, there's so many different variables in it. And so that heterogeneity was definitely seen in that sample. So, and one of the important things that the researchers wanted to point out is that it's important to not assume low desire towards anything as some kind of pathological behavior, right? Pathological presentation. And we'll talk about that later, how we don't want to pathologize anything that we see in these in clinical settings. Now, more recently, there was another study done by Simon Baron-Cohen, actually, who is the grandfather of autism research, who came up with a theory of autism and systemization theory. So he usually produces great studies, and this is one of the first at that time in 2021 studies that had huge number of participants. Look at that, 2,386 people participated, and half of them were those on the spectrum, ages 16 to 90. This is really unusual for psychological studies to have this many people. And these are very interesting outcomes that they received from the study. So they found that autistic participants were less likely to report heterosexual identity. So there was a lot more likely report of sort of the asexuality, LGBTQ, and all of the other possible sexual identities we've described. So again, this is in comparison to neurotypical adults compared by age, right? So very important. So it's definitely um, more likelihood for someone to present that way. Most autistic adults reported interest in relationships and many reported sexual activity. That goes exactly against the myth that we were talking about earlier, that individuals on the spectrum are not interested. Um, and are not active. They actually are, but maybe in the different possibly ways. Autistic males were uniquely more likely to be bisexual. So they would identify as bisexual versus heterosexual or homosexual. Conversely, autistic females were more likely to identify as homosexual, right? Again, compared to neurotypical counterparts. But when you were comparing the two, autistic males and females directly, females were more likely to have diverse sexual orientation and engage in sexual activity. So there was more different, I guess there were more differences and more sexual activity present in females. they were less likely to identify as heterosexual and had a lower mean age in terms of the beginning of their sexual activity, which makes sense because all of the literature shows that it is more likely for females to begin to get into their romantic relationships earlier than the males on the spectrum. So that definitely coincided with what we've been seeing. Um, Another good study already from the United States, because Simon Baron Cohen he's in England, so this was a sample from England. But in the United States, we've seen something similar. A large proportion of reported asexual minority identities. Sexual minority autistic adults reported higher anxiety, depression, stress, and lower quality of life than heterosexual autistic adults. Now, that has to do with people's reaction to their different sexual identities, right? And this is not just for those on the spectrum. This is for anyone who identifies as a sexual minority. There's frequently additional stressors that they experience in life, and therefore will report higher levels of anxiety and stress and depression possibly. So, which means that this was very similar to the neurotypical experience. So experience of being identified as a sexual minority is very similar between those who are on the spectrum and who are not. And now these four studies are from 2025, and I promise I'll stop with the studies after that. So in 2025, there was a systematic review. So basically, they looked at 56 studies, did this meta-analysis of sexual health, knowledge, and behavior in those with ASD. And they showed that the sexual interests and needs, alongside gaps in sexual knowledge and education, social and sensory barriers, and elevated concerns about vulnerability, victimization, all supported the need for tailored sexual health education. So basically, because of all of the same desire that individuals on the spectrum have, because of the gaps in knowledge and education sometimes that they receive because people don't think of doing so, or try to avoid to talk to individuals on the spectrum about that, because of the social and sensory barriers, which we'll explain a bit later, um, and of course concerns about vulnerability and being a victim. All of that requires us to be more direct and have these kind of presentations like today to talk about these things openly, so that this information is absorbed and included in the person's cognitive processing of their sexual identity. So but and so, as I mentioned in 2021, 2000 was a huge study. Now look at this study with 10,419 participants. That is, again, unheard of. I'm so proud of them actually doing this. But finally, we're getting this large international studies, which means that it's not going to be the value system is no longer an important variable because it's controlled for by getting subjects from different cultures. So the estimate shows that 6.9% of people who are diagnosed by professionals with autism are somewhere on the asexual spectrum. That's a really large percentage compared to the neurotypical. Autistic asexual spectrum participants were more likely to identify as non-binary, transgender, aromantic, and asexual, and so on and so forth. They were also more likely to disclose their asexual identity, which means that they were proud of it and they were talking about it more openly, which is, again, a great point to remember, because while we don't want to talk about it, individuals on the spectrum don't seem to be protective of that information, and actually do find some kind of solace in disclosing that. So very important study. And again, with such large number, we know that we're talking about something that is, really well descriptive of the population. So another meta-analytical study showed that, of course, this same concept, elevated prevalence of gender diversity. So that's not nothing new. Again, around 7%. So very similar percentage. And another interesting study, and that's the last study I'll talk about, where they did a randomized trial of effective social intervention for those on the spectrum and parents, showed that with intervention, the improvement in sexual knowledge and self-protection skills was seen that was significantly relevant. And so, which means that, if we support our adolescents and parents and provide the right information, we can actually create a difference. And again, this is a randomized controlled design, which means it's not some kind of placebo effect. It's actually the effect of the intervention itself. So again, very exciting. I was a researcher first before becoming a full-time clinician. So these are all exciting outcomes. Now, of course, and I'll skip through these. These are all the research studies. They show very similar things. Um, there were a lot of them. Like I said, I'm going to just skip through them. But just to summarize, that there's definitely research gaps that still remain, right? Like, for example, we don't have as much information on females who are on the spectrum, those who are part of LGBTQ plus, sort of kind of diving deeper into that, and definitely less on older adults. How do they experience their sexuality? Cultural diversity is also underrepresented. Even though we're getting some of these studies from different countries, it's not necessarily large-scale studies in every country combined together. Also, we definitely know that females with autism are underrepresented, as I said earlier, but we now know why that may be so, and a lot of times it's due to the social masking. Even though they have higher social skills, sometimes they may still experience higher rates of sexual victimization and stress from relationships. So again, it's important to develop a more specific treatments for those who are females on the spectrum to address these issues around sexual identity. Okay. Okay. Any questions before I move on? I know it was a lot about research, but I think when you guys go back and you kind of read some of these outcomes, I think it's going to be really helpful, and it will sort of will put the picture together of something that is fairly complex. Okay. In terms of sexual practices at this point, so we definitely know that there's 15 to 35% in homosexual or bisexual orientation than in non-ASD population, so larger percentage, right, in terms of actual practice. Um, so a lot of people will ask, well, why is gender not relevant in choosing a partner for our population? And so some people have postulated that it could be due to limited access to romantic or sexual relationships, right? Um, which means that it's harder to get into a relationship where one can experience their sexual identity and orientation. And if you are limited in that, you may begin to open yourself up psychologically or normalizing it for yourself to experience other options, whatever they may be, right? So this is when the fluidity, gender fluidity, maybe instead of being pansexual, omnisexual, all of these concepts become much more relevant because of that limitation, right? And the limited social experience, as well as the socio-sexual exchange with their peers. It's a fancy word for saying, basically, if you don't have a lot of friends to talk to about these things, well, you're not going to learn a lot from them. So you're literally not learning from other people's experiences to add to your personal experience, right? So teens and young adults talk a lot about that with their friends, and they discuss sexual experiences, ideas, and thoughts. If you're not socializing as much, then you're definitely having more limited socio-sexual exchange, as they call it, right? And in combination with the less sexual knowledge that we just discussed from research, the orientation and understanding of sexual orientation and preferences may be restricted, right? And therefore, that's what may explain the 15 to 35% of the homosexual or bisexual practices, because of the sort of lack of the opportunities, right? Okay. Oh, and another important point, I'm sorry, that and another reason why a lot of times we see individuals on the spectrum being very open about their sexual identity or sexual orientation and practice is because of the theorized concept of lower sensitivity to social norms or gender norms, right? If you do not really worry about your presentation to other people, that a lot of neurotypical individuals have those worries, then you may be more open about it because you're not really worried about the response that you're going to get from your community, from your uh, parents or friends or whoever it is in your social environment, right? So you don't really think of that as a variable to consider, and that's why being open becomes a little bit easier. Okay. In terms of the sexual behavior, individuals with ASD reported more solitary practices than person-oriented sexual behavior. So less desire to have sexual intercourse with a partner than NTs. Well, we will talk about this later, but I think it has to do a lot with some of the sensory challenges as well as the social difficulties, right? The social exchange with your partner can be difficult, and to get to that level, one may actually show that they're not interested in the sexual intercourse because it will require significant involvement with the sensory issues as well as emotional issues that are attached to that. And so therefore, there's a less desire to have that intercourse. That's why we see a lot more identification as asexual individuals, right? Um, Again, we've talked about this regarding the social norms, so that's definitely something that's present. Now, interestingly enough, there's higher rates of hypersexuality in men who are on the spectrum. But there's a hypothesis that it has to do more with the repetitive behaviors, right? You probably have heard about self-stimming, right, as a concept. And when self-stimulatory behaviors produce significant releases of dopamine, that's why that behavior continues to happen, whatever that may be. Now, once someone reaches the developmental age, not chronological, but rather developmental age where they begin to engage in, let's say, masturbation or any other sexual practice, that powerful dopamine release that one experiences can sort of produce that same sort of level of attachment to that behavior. And therefore, it becomes a very similar repetitive behavior process as you see in self-stimming in younger children, right? Um, Also, the sensory peculiarities can add to that process because it can become much more powerful, right? There's a lot more dopamine release, a lot more sort of consuming emotional response, and because of the sensory sensitivities, and that can become very difficult to avoid, and therefore you begin to engage more and more in that kind of sexual activity. Okay. Um, Now, again, the masturbation itself is more likely because it is a simpler process to achieve, especially if you have any kind of issues with social skills or difficulties with connecting with others, basically being in these kind of dyadic relationships. Okay. So therefore, we see excessive masturbatory behavior as a reasonable response to the other challenges.
Hi, Dr.
Hypersexuality.
Gantman.
Yes.
Hi, there's a question about what is hypersexuality in the chat.
Hypersexuality is basically, again, it's going to be context dependent, right? But basically, what would be the norm, a normative behavior? Let's say, if for males, masturbation when they're, let's say, 18 is what, 2 or 3 times a week. So if that is the norm, right, the hypersexuality would be someone who goes above the norm, right? Whatever that may be. It could be every day, it could be multiple times a day. It could be basically going above, significantly above what the normative expectations would be for that age group. Yeah. Hopefully that answers your question. But it doesn't have to be masturbation, and I'm just using that as an example, but it could be engaging with other people in sexual activities, seeking sexual stimulation. There could be many different parts to how you express your hypersexuality. It doesn't have to be just in one way or another. It could be multiple. By the way, it doesn't always, it's not just for the spectrum group. This is also, for example, something that bipolar individuals can experience during their hypomanic or manic states. We see a significant increase in hypersexuality. Um, there's other conditions like borderline personality disorder sometimes will have the excessive hypersexuality. It can be also part of certain other addiction disorders, such as addiction disorders that kind of create hypersexuality with the use of certain drugs, for example, illicit drugs. So it's not just for those on the spectrum, but again, the explanation for why it may happen more on the spectrum is because of this sort of the dopamine hypothesis.
Okay, thanks, doctor. There's a follow-up question to that.
Sure.
Should a parent be worried about that hypersexuality?
Again, I think depending on how old the individual is, right? So we've talked about how some of these behaviors begin to change over time. Um, Again, clinically speaking, right, that there's no problem as long as the person is not causing any kind of harm to themselves in the process, right? So they're not doing any kind of bodily damage, or if they're still able to perform all of their daily activities and duties, right? So it doesn't interfere with the daily process. So again, that's a very sort of general, of course, definition, but it depends on the situation, how old they are, what they're doing. Of course, the norm shifts, right? And then the problem with particular sexual behavior, depending on what it is, can also add an additional variable to consider. So we'll talk about, for example, paraphilias, right? If the paraphilia is illegal, then it is very problematic, right? And so even even if it is within sort of the normative standards of what somebody with paraphilia would do, certain paraphilias are, have almost zero tolerance in our society. So not almost zero tolerance in our society. Um, so hypersexuality, to finish this last point, could also lead to lower baseline of sexual disgust, right? So when somebody is really in that state of seeking stimulation, less things are they feel less disgusting to them. Therefore, there's a chance that they'll be more open to certain as we call them paraphilias, or things that go outside of the usual normal sexual practices, right? And therefore have lower aversion towards that, whether fantasies, behaviors, or actual or both. So that's why sometimes that hypersexuality is an explanation why those paraphilias may exist, right? This dopamine-driven behavior. Now, how does the sensory processing is involved in this situation? Well, sensory processing differences significantly shape sexual preferences, right? And comfort. So, for example, if someone is, I'm going to use this as an example, does not appreciate the human touch, or if it has difficulties with human touch, there's still going to be a need for sexual release, and sort of one can become, through certain paraphilias, become sexually attracted to or engaged with inanimate objects, right? Because the requirement of physical touch with the person is just so overwhelming. As it says here, you may begin to avoid the touch of others. Now, hyposensitivities, right? Because individuals on the spectrum are not always hypersensitive to sensory issues. Sometimes there's a hyposensitivity, right? Less sensitivity may lead to seeking out more sensory, more intense sensory experiences, which again may lead on the path of certain paraphilias, right? And that dictates sort of our preference shaping. Emotional regulation is another important part of what defines our sexual expression and practices, where anxiety and emotional regulation difficulties may influence intimacy. Fear of rejection, performance anxiety, and overwhelm can inhibit sexual expression. So basically, because we are afraid of getting rejected by somebody, because, for example, we're afraid of performing well during sexual act and being overwhelmed with this, we may not express ourselves as being sexual beings, and it kind of creates the asexual uh, uh, categorization of someone's sexual orientation, right? So if I'm too afraid to get into a relationship, I'm overwhelmed with the emotions that are attached to that. I'm afraid to start the intercourse because I'm not sure how I will perform, what will happen. you know what, I just rather not deal with all of this, but I do want somebody who is close to me, somebody I can trust, somebody I can love. And that's why we're going to engage in this kind of asexual relationship, right? And so therefore, it's important that in our population, we do address the underlying anxiety, we do address the underlying emotional dysregulation issues, so that this is not part of the development of that sexual orientation. Right? It's one can say what's the chicken, what's the egg, but if we know that we can, for example, help people with anxiety, if we can do that, maybe that affects the way that they self-express through in their sexuality. So very important to not miss that, especially in therapy. You know, I think there's definitely something to discuss. Um, so again, this is just a slide for you guys if you guys interested in attachment theories. But of course, individuals with autism often exhibit attachment anxiety or avoidance due to early relational experiences with their peers, usually, and even with parents. And because of these attachment issues, it may affect how they show, how they express intimacy, right? As part of sexuality, we mentioned intimacy. If you have difficulty with attachment to others, you may create a distant attachment, which is not really conducive to a good relationship. And so attachment needs to be addressed as well if that is seen to be part of the whole equation, right? And it definitely can be addressed therapeutically, but it cannot be dismissed or assumed that attachment is normal. Um, Again, this goes back to the emotional issues due to the social vulnerabilities, right? The social skills challenges, communication skills challenges can create difficulty interpreting other people's intentions, right? So non-behavioral non-verbal cues in a social situation, understanding when consent is there, um, understanding how to draw boundaries because they're not comfortable in terms of expressing themselves. And you know, we definitely know that safety is essential and absolutely necessary for this population. So focusing on the skills that are relevant to safety and boundaries to address the social skills issue for example, in therapy becomes a priority before we begin to expose the person to any kind of sociosexual setting. Because if you don't know how to do that, you're prime for possibility of being victimized. And so we definitely can't have that happen. This is why when we developed our program at UCLA, the Peers program on dating, there was definitely part of the sessions on dating were around drawing boundaries, realizing how to say no, having the social skills to do so, and understand that you have all the rights and sort of to say what you feel you're comfortable with and what you're not, and being able to do that in the right way, not in a very sort of jarring way, is important because you can protect the relationship while drawing boundaries. Just because you're drawing a boundary doesn't mean that you end the relationship. So social vulnerability is definitely a key factor. Um, And just in general, I think, it's important not to pathologize whatever we see. For example, someone's hypersexuality can be really clearly understood within the context of where it's happening versus outside of that, right? And you have to take a look at the individual variables to see why this may be the case, right? Like sensory seeking rather than deviant behavior, right? So if somebody's engaging in sensory seeking, then we know that there's something that's missing in terms of the stimulation, in terms of the dopamine surge. And so maybe there's something else that can be provided that will decrease that behavior without us labeling it as being deviant in one way or another. Um, it's important to talk about sexuality as something that is normal, yeah, and addressed directly. I know a lot of times parents feel uncomfortable talking about this with their kids. Therapists actually are feeling uncomfortable talking about this, and sometimes they don't know how to engage in this discussion well with those on the spectrum again because they're not really sure how to assess where the person is in terms of their sexuality. Um, But I think the way that I usually do this, it's very direct, it's very open. There's, appropriate language being used. There's a lot of psychoeducation that happens in practice. So the more information the person gets, the more they can coherently describe their attitudes, their feelings, their sort of identification. And a lot of times we've talked about this in many other previous sessions that I ran, that a lot of times people think really super fast. It takes milliseconds before a thought is produced. And a lot of times those thoughts are not very well developed. We just assume that they are rational or coherent, but a lot of times they're actually not. But we jump from one thought to the next, and we create this chain of thought now that is based frequently on incoherent or irrational thinking. When you're talking about this directly with your parents or with other professionals or with your friends, you're forced to express yourself. You're forced to express yourself directly, coherently, so that the other people can understand what you mean when you say certain things. And when that happens, you for yourself develop clarity. That's why it's so important to talk about this directly. And in terms of the therapeutic interventions, of course, as I said, psychoeducation, social skills training, sexual skills training, dating skills training, all of that is very important, and definitely regulation support to address the underlying anxieties and emotional dysregulation. But again, it has to be done in a respectful, strength-based manner, right? So rather than going back to the myth of asexuality as somebody who is a childlike and doesn't need to be taught about the details around the sexuality and the sexual identification, orientation, and practice. Families play a critical role. We talked about the study earlier where they involved the parents in the treatment. We see this a lot. With our peers program at UCLA, we had to involve parents in the in treatment and teaching teens and young adults the right social skills. Just having parents involved means everything. Their component in the treatment is extremely important. So family role continues to be extremely important because you have the most time spent with your child and you can give them more and more information, more and more support, more and more education around the topic, but you have to be comfortable with doing so. It's our anxiety that prevents them from learning what they need to learn. So it's important. Right. So ethically clinician, well, okay, so we can skip that. Everybody understands that sexual rights are very important. Autonomy is important. You have to protect, but not overprotect, right? So you have to make sure that they're safe, but not necessarily say you should avoid or don't engage in sexual practices because that, according to research, that's not what happens naturally for our population. Okay.
Doctor, we have two questions.
Okay.
The first is, are there any peers type programs in Orange County? And second, how do we get dating and sexual skills training?
So, well, this question comes up a lot. A lot. We are working on starting the young adult program that includes the dating skills in it. Once we identify a good location where we can do this, we've been doing this since 2010, and then when COVID hit, after 9 years of running peers in Orange County, we had to halt that process. We haven't been able to restart. But I'm definitely interested in doing so. So if anyone is interested, please email me, and we'll put you guys on the wait list for the program. I'll put my email at the end in a group chat. Oh, those are two questions. Okay. All right. So in terms of hypersexuality and paraphilias, there's some gender differences. As we mentioned earlier, males report more solitary sexual behaviors. Females often experience masking or underreporting, right? So that is actually very similar to what we expect from the neurotypical population, where females rarely will talk as open about their sexual practices as it is seen as a negative behavior due to social norms, which is completely ridiculous, of course, but that's unfortunately translates into our population as well. And also for female, it may be a little bit easier to get involved in a sexual practice of sexual relationship with someone than for a male, considering that females on the spectrum have a little bit higher social skills. So therefore, there's going to be less need for the solitary sexual behaviors. But because females do get into those relationships with higher frequency, well, there's definitely higher frequency vulnerability and victimization. And therefore, as I said, we have to be very mindful of the differences, even though it's the same sort of a population on a spectrum. So a pattern of sexual behavior or arousal that appears problematic in the eyes of other individuals or society are called paraphilias, right? So someone asked earlier about hypersexuality. That can also be sort of in the category of paraphilias. And by the way, there's paraphilias towards everything, right? So it's basically when you begin to experience sexual arousal to an unusual stimuli, such something that is usually not producing that kind of sexual stimulation in people who do not have paraphilias within the norms, right? So there's of course the norms are pretty broad, but something that would be considered outside of those norms would be something that is unusual and therefore categorized as paraphilia. Let's see. Okay, so I don't know if you guys want to get into sort of how paraphilias are formed, but if you want, we'll come back to this slide later. I want to leave enough time for questions and answers, because I think that's more supportive of our group. These are different types of sexually atypical behaviors. So fetishisms, when sexual arousal is caused by an inanimate object, right? Transvestism, sadism, masochism, zoophilia, basically fantasies that have to do with animals, and so on and so forth. But you know, we definitely have seen some of these play out in our population. I've had clients with a number of these paraphilias. Like, for example, paraphilic infantilism, where sexual fetish that involves role playing or regression to an infant-like state. Had a client with albinophilia, which is basically being aroused by a human navel, right? So a very particular part of the body that usually does not produce a sexual response in people. Now, again, we talked about about fetishisms, but more specifically about objects. Different objects produce romantic attraction. Had a client who was attracted to computer-like sort of figurines. Again, it was very specific. But what we see a lot of actually in our population is what's called tunophilia or schizophobia, which is primary and exclusive sexual attraction to cartoon or anime characters. Now, anime has been big in the United States lately. It's a great form of entertainment. I think it's amazing that it's growing here. But it's interesting that our population is drawn to anime frequently. Not everyone, but there's definitely a draw to that. Through that exposure, through that experience, spending that much time focusing on something like that, one can begin to develop an attraction to these animated characters, right, or cartoon characters. There's a whole field of anime that's specifically dedicated to more sexual content called hentai, and so that is definitely an atypical behavior, right, or can be called a paraphilic behavior. However, you know, it wouldn't be a problem until it becomes a problem in the relationship. And when the client comes to me and says, I'm really attracted to this character from this anime, for example, more than I'm attracted to a person that I met at school, you know, this is when it becomes an issue that needs to be addressed, right? So there's a lot of different disorders. We don't need to get into these. You guys can read about them if you're interested in learning about that. There's definitely treatments for paraphilias, from psychoanalysis, hypnosis, behavioral therapies, CBT, and so on. There's hormone therapies, as well as use of some antidepressants to lower the libido drive so that you're not as hypersexual or hyper aroused during the moments of engagement with these fantasies. If you guys are interested in how it's done, we can go back to this slide as well. I want to skip through this. All of this is going to be available to you. It's very interesting, but it's also very important to understand that, for example, assisted aversive conditioning, right? It's basically when you're presented with a stimuli that shouldn't produce the sexual reaction, and then you were producing that sexual arousal, for example, followed by a very negative consequence. Before, in the 70s and 80s, they were trying to use even electrical shock as a response to decrease the arousal and impair whatever the stimuli that shouldn't be there from your sexual arousal. That didn't really work that well in certain paraphilias, in certain disorders. So even though it is possible, it's very difficult to do. And before, it also was used on certain sexual orientations where they were trying to, let's say, change the person's orientation from, let's say, being gay to being straight and so on. And again, that didn't really work that well. But with smaller sort of associations, the less powerful paraphilias is definitely possible to do. And of course, there's more positive sort of ways of doing that. Reconditioning, positive conditioning, alternative behaviors, masturbation training. All of this can be, done to help somebody sort of move past that. So, and again, the reason why we want somebody to move past that so that they can begin to engage in more realistic life sexual experiences with their partners that they're connected to. So one can be asexual, for example, as we said before, in terms of they're interested in a relationship, but they're not engaging in sexual practice with their partner. But it doesn't mean that they don't have a certain sort of paraphilic tendency that they practice individually, right? So they may be doing something on their own that satisfies that need, but they just can't transition and transfer that interest to their partner, which is really problematic because at some point the partner may have a difficulty with that. So just to kind of summarize, it's important to reframe sexuality and autism. Sexuality and autism should be reframed as difference rather than a deficit. Empowerment and support lead to healthier outcomes. We definitely know that. So the more we talk about this, the more direct we are, the more information we present with, the better the outcomes are going to be, and the more sort of specific choices an individual on the spectrum can make in regards to their sexuality, sexual identity, sexual orientation, and sexual practice. So, oops. Okay, guys. Well, I kind of rushed through all of these because I didn't want to overwhelm you guys with even more information. But I think it's a good time for us to do some questions and answers. So now I think I'm going to be able to hear you guys. So if you guys want to just raise your hand and you don't have to type it in the chat, unless there was already some questions in the chart, Robin.
There is one in the chat we haven't asked yet. It is, can you have a sex drive but still be asexual?
You can have a sex drive. It's just a matter of whether that sex drive is diverted elsewhere, right? We talked about, for example, paraphilic sort of interests, like being interested in something that is not, let's say, within the norm of sexual practices. So you might be in a relationship, but let's say you were practicing that sexual need in a different way rather than with your partner. It's also something that you may be there, but may be affected by emotional experience, right? So the anxiety, the social anxiety, performance anxiety, just being overwhelmed sensory wise. So you may find your own ways that satisfy that need, that rather than experiencing that in a relationship, right? So there's different ways to address the drive and desire, but still sort of act in or identify as asexual because you're not engaging in the in sexual practice while you're in the relationship or while you're looking for a relationship, for example. Hopefully that. Okay, guys. So let me see if I can. Oh, can I